pag-usapan natin ang UNTV Cup, pag-usapan naman natin ang patungkol sa ating health. We have our guest this morning. Good morning. Have a seat, guys.
Hi. Hello.
Ayan.
Nice to see you
Pasok
again.
po.
Hi.
Let's go in. And here, we can have a seat here, sir. Ayan. Siyempre, nakilala na natin si Dr. Alaa. Ayan. Dr. Alaa is the head of medical research. Have a seat, sir. Ayan. Welcome to our house.
Thank you.
Ayan. Have a seat.
Nice to see you
Dr.
again.
Alaa is, of course, the head of medical research ng department ng Labdom R&D Incorporated. He's been there 25 years in experience. Have a seat, sir. And of course, graduate siya sa Cairo University Medical School at member siya ng Royal Collagen UK of Endocrinology at member din siya ng UK Royal Society of Endocrinology at member siya ng Society for Echocardiogram. At siya yung nag-introduce sa atin ng special screening test for breast, for prevention, which we tried.
Tinry namin yan ni
Nating
Italia,
lahat.
tayo lahat.
Tayong lahat actually,
All
ng mga
UNTV
babae.
last time was
Ouchless.
Yes. So good morning once again.
Good morning.
Hi, nice to see you.
What's so special about this machine, because we have a lot of
Inquiries already.
Yeah.
But before that, I wanted to introduce to you also, we are privileged to have with us today, siya po ang pioneer ng World of European Integrative Complementary form of biological medicine. Siya rin po ay nag-start 28 years ago sa research and development of regenerative field of cellular therapy and stem cell. Ayan, nandito natin at kasama natin ngayong mga kasambahay. Siya po ay meron ding pag-aari ng laboratory and clinics dyan po sa Europe kung saan nakatulong po ito ng malaki sa mga sinasabi nga nilang hopeless cases po, untreatable diseases such as autism, cerebral palsy. Nakatulong yung clinic nila. Degenerative disease. Here we are. Let's all welcome Professor Mike Chan. Morning, sir. Ayan. Thank you so much. Okay, so umpisa na natin. Let's start again with Dr. Alaa. How is it? How many times have you been in the Philippines already,
Don't
sir?
count.
Cannot count anymore.
I stopped counting. After 20, I stopped counting.
But the last time you were in the clinic doing the screening, breast screening for our indigent patients, how many patients were you able to check?
120
120.
in 3 days.
And how was it?
We got 40 of them, got some positive prediction. We will re-examine them again after 6 months. And the others were green, 80, almost 85 green, 35 has hotspots. We double-checked them by the echo Doppler, and we found some signs of vascularity. So we will double-check them again after 6 months before we take surgical procedure to prove either it is cancerous or no.
I want to ask you, doctor, because in every machine, we try to see how the percentage of predictability, right? Now, if you're talking about this is with the use of temperature to monitor whatever disease the breast has, beyond its normality, I just want to see how high is the predictability of this machine in detecting breast cancer or early stages of breast cancer.
Early stages of breast cancer is an area now no machine can detect it.
Right.
Except this one, which I consider it like a landmine detector. Because it points to us the hot areas in the breast. Hot area, when cancer starts, there are some metabolic changes and some vascular changes. These both make the area of the very, very beginning start of the cancer hotter than the other tissue. So this machine point there is something wrong here. It cannot say it is cancer or not. We need to make more investigations. This is the second step, which is the bioecho Doppler, to see the type of vascularity of this hot area. When we see some pattern of vascularity, we start to suspect the patient.
So, but how high is your predictability? Like when you're saying areas of normality later on, because we have to translate for other diagnostic workup. How high is your machine in detecting and later on for us to further
This question
diagnosis
is the one which the trial answering.
All right.
By the trial now, we want to know this combination of the two technologies, two non-invasive technologies. how many percent it can show us 100%, 90%, 85%, whatever. The best we have in the market now is the mammogram. Mammogram predictability is 47%, which is nothing, below 50%. So my anticipation is to be 75 plus, but I cannot say this till I see the cases, till the cases prove at the end of the trial. How many cases we suspected and they are really cancer and not. This is what we call it, the positive predictability and the negative predictability.
So we're doing trial here, local
in the
trials.
clinic right now.
Yes.
And it's nice because we have in the research, you've mentioned that it was also like the last time you were here, with the use of, for the cervical cancer, with the use of pap smear, we were able to prevent cervical cancer 80%. So that's what we're trying to do now.
Pap smear saved 55 million lives of females in the young ages and old ages every year. And this is what also anticipated from from our technique today. Hopefully it is successful as we are now. There are lots of positive predictors, but we cannot say final conclusion till all the trial finishes. If it is successful, the number will be not less than 45 million lives to be saved a year.
Wow, congratulations. Let's talk to Professor Mike. No? You've been in the industry for 28 years, and you're more on the cellular study of cells and how it can work on us. Can you tell us more about the reason why you looked into that practice?
Now, basically, the human being consists, in their body, they basically have around 200 to 200 different types of cells. Even for the brain, you may have more than 20 types of brain cells. Okay. So in the diagnostic of disease and disorder, we have to really know which part of the body is not in a good shape or condition. You see, as we age, all the organs of our body age.
Yes.
That means our liver, our lungs, our brain, everything will shrink as you age. That means they also have a different lifespan for each organs. So we have, in the case of biological medicine, we have to diagnose which part of the organ is not in good shape, or certain part organ may be in a dying stage, the cells. What we are going to do here is that we have to give some cells, which we call feeder cells, and precursor feeder cells. Precursor means it's predetermined. It's like in the case of liver. In the case of liver disorder, you may be having, in the liver itself, there could be 70 to 80 cell types. But what is needed much for the repair of the liver is that we have to give hepatocytes. That is the real liver cells for the repair of liver. It's just like another case would be in the case of brain disorder. You know, someone could be, let's say, a Down syndrome or autistic children or a Parkinson patient. Which part of the brain has been damaged? And we have to determine that part, and we have to target that part, and we give that particular cells. So this is what we do in the field of bioregenerative cellular therapy. Okay. In this part means we really have to diagnose very carefully, because if the doctors were to give a wrong diagnosis, then you will give a wrong prescription of cells.
So how okay,
yes.
Go ahead, sir.
And so what we are trying to say in the field of European biological medicine is that the body is able to repair by itself.
Yes.
Okay? If you were to find out the right disorder and which part of it. Okay? So this is how we do it. But of course, if you don't diagnose properly, then there's no way you will repair the body.
Right. But how do you get to diagnose which cell in your body is already aging or dying?
Yes, or which part of the organs.
Which part
so that's
of
why
organs.
we have biological or biomedical devices, and one of them is this bioradiometry. Of course, along the way, we also have many other new medical devices from our side. So we are trying to bring the technology down to Asia. To the Asian community, this is totally new. So with affluence society, everyone is more concerned about their health. So this is a time where we have to give them some very advanced technologies. It's not just to look at a full blood test of your report to say, oh, you have this, you have this. Now we have two methods, the conventional methods with the pathological blood test report. At the same time, we also have our machines which can tell certain reports. So it's always like two brains is better than one.
That's true.
Okay.
That's true.
Sir,
Yes.
last question. Because basically, in that line of thinking that prevention is better than cure, what about those supplements? Like, let's say you're mentioning about the liver, because the liver is one of the most hardworking organs of the body. Let's say supplements like silimarin or like milk thistle. Does that help if you take it regularly to keep the liver in good shape?
Yes, to a certain extent, I would say some herbal supplements like silimarin or milk thistle,
yeah.
you know, there are some of the belief that it does help. In our opinion, I think it does, but that is only to a certain limit.
Right.
Okay, and when you talk about liver, remember I was saying there could be 70 different types of cells in the liver.
Right.
Because the liver is like a factory, filtering factory.
Right.
Everything goes to the liver.
Right.
And the liver is having a tough job doing his job all the time. And if you cannot do it, means it's over exceeded its function. You have to pass on the job to the kidney. That's why when you have a poor liver, you will end up with a poor kidney.
It goes together.
Yes, it always goes together. And those with liver problems will also have some problem with the stomach. Okay? And the liver in biological medicine need to rest. You know, everything needs rest. Okay? And that's why we need sleep. Sleep is very essential because regenerations of the liver or the human body can only take place when you sleep. If you don't sleep, you will never regenerate. So if someone were to work at night all the time compared to someone who work in the daytime, it's different. Because the human body biologically was meant to sleep at night. And you didn't sleep, and you were stressing your body.
Right.
So you can see that they age faster. Every one of us age differently.
Yeah.
Okay.
So it's also the sleep and the rest. That's a big factor.
Yes, of course, genetically, someone may have some other things. It also depends on the lifestyle. And when you talk in terms of preventive medicine, then there's a lot of ways to put you in good liver shape. Now, of course, through the kidney or the liver function in your blood test, we can tell to a certain extent how healthy is your liver. If you are having some high liver enzymes, you know, there could be indication of some inflammation in the liver. And with biomedical technologies like what we are having, we can actually give you some liver cells or liver extracts.
Wow.
Okay? What works better for your body is on the principle of similibus curanto in Latin, which means like cure likes. Okay? So the best thing for liver would be to give a liver. The best thing for your heart would be to give the heart. The best thing for your eyes region would be for the eyes. And the best thing for the different malfunction of your brain will be that particular brain cell. It could be a medulla alba or frontal lobe of the brain or some other things.
Wow, it's pretty complicated.
Yes,
Yeah, it is.
All right?
Really?
Yes.
Oh, thank you.
Let me
Yeah.
add something. The difference between the supplement and the cells
Yes.
is huge because a cell, if you imagine, one cell will be an organ in advanced stage. So it has all the potential and all the factors and cofactors. What it needs is just some from the environment, which is inside the uterus is the uterus, inside the body is the body itself. It needs some nourishment, some nutrients, and the factors and cofactors are present in this cell. So it can regenerate highly. It's one cell, can be an organ. Has this, what is in silimarin, plus other factors and cofactors. Yeah, it has it all, has all the factors which can be an organ later. This is why it has a very high regeneration power.
Okay. Well, thank you so much, Professor Mike. We are learning a lot, and there's a lot more to learn from you guys, but we are running out of time. Maybe you can tell us the website where they can go into and to learn more about Labdom, and also the telephone number where they can get in touch with you for additional information about the wonderful equipments that you're bringing into our country.
Yes, one of the website could be www.labdom.com, labdom.com. And of course, another website will be mf3swiss.com, mf3swiss.com.
Okay.
All right. And we are reachable. We are reachable at info@labdom.com.
There you
All right,
go.
yes,
And they're
yes.
here quite often anyways. You'll be visiting us whenever you're here. Please promote, you'll be at the clinic again, no?
Yes.
You'll be going...
No. And for breast cancer, this time, no.
Not this
Yeah,
time.
but this time for the consultation of patients of endocrinology.
There you go. He's back to do public service in Clinic ni Kuya, no longer for breast screening, but for people with problems with
Yes,
their
and
hormones.
diabetes, hormones, hypertension.
So you'll be at the clinic today?
Yes.
All right. Well, thank
Well,
you so
basically, what you heard is only on the breast side.
Yes.
Of course, with the same machine, with other devices, props, we can do even on prostate
On
cancer
prostate.
or
Wow.
liver or some other parts. you
Yeah,
know.
Dr. Lee is a
Yes,
urologist.
yes.
Yeah.
It's not just on the breast, but of course the breast is every woman's main concern. So one of these days we may even have to go to the male side.
There you go.
Yes, yeah.
Prevention is always better than cure. Once
Yes.
again, thank you
Yes.
so much, Professor Mike Chan.
lifestyle.
And live a healthy lifestyle. Of course, Dr. Alaa, Abdelkarim, thank you for being here. And we hope to see you once again to discuss more about this wonderful products that you have for us. Thank you so much. Maraming salamat. Okay.